Good morning. My name is Dr. Alexis Harper. I'm the Criminal Justice Planner for El Paso County. On behalf of the Criminal Justice Coordinating Council of the Pikes Peak Region, I would like to welcome you to the first of hopefully many major collaborations between our region's criminal justice agencies and behavioral health service providers. As passionate individuals in our field, we have worked very diligently to address various issues facing individuals with behavioral health concerns, including any risk of justice involvement, and how to help these community members to gain treatment and avoid jail. Each of you and your organizations are here today because you play an integral role in addressing and meeting the needs of individuals with behavioral health concerns. Many efforts involve providing care to decrease the risk of initial criminal justice system contact, while others work to promote a continuum of care to prevent any further justice involvement. Attending this summit is recognition that we value the interest to do more, to expand services, to bridge gaps, and to provide the best services for our citizens together. Please welcome Commissioner Vanderwerf.
Now, the sheriff estimates that half of the inmates in the jail have mental health concerns. I will estimate that I think it's actually much higher than that. And we also recognize that individuals with significant mental health issues need a higher level of treatment that may or may not be readily or easily available at the jail. So this can be a component of our conversation today about how to deal with that. Now, we also must continue to find ways to divert people with mental health concerns from jail and to break the cycle of repeat criminal justice involvement for these individuals. This is a really important component. We know that if we have something that isn't working exactly right and we just kind of repeat the effort over and over again, that doesn't really deliver results for our community. That's something we need to analyze and assess and see if we can come up with alternative ways to break that cycle so we can end up in a healthier community. And I know that many of you look forward to innovative ideas. I can tell you I am looking forward to some innovative output from this conference and subsequent meetings to address expanded treatment services, to reduce incarceration, and also to reduce recidivism. And we recognize that this is not just a law enforcement issue. Bringing together law enforcement and behavioral health experts to discuss the issue is a key element of our potential for success. And we will need to take a holistic approach to provide the needed services for those individuals suffering from these mental health issues. So each of you and your organizations that you represent are here today because you do play an integral role in addressing and meeting the needs of these individuals with behavioral health concerns, and you play a role in doing what we can to ensure we have a healthy community. These involve providing care to decrease the risk of initial criminal justice system contact, and others can also work on providing a continuum of care to prevent further criminal system involvement. So attending this summit, again, as I mentioned, is recognition that we know we must do more to expand these services, modify these services, and produce a more effective output for our community. It's also a device and a vehicle for us to bridge gaps and to provide the best possible behavioral health services for our citizens, to reduce the impact on our criminal justice system, and to reduce the stress in our community and our citizens. So at this time, what I would like to do is introduce Chief Judge William Bain, and he is somebody who is regularly involved in the intersection between behavioral health and criminal justice, and he is acutely aware of our need to make further progress in this area. Ladies and gentlemen, please join me in welcoming Judge Bain.
We all recognize the enormous gaps that have existed for years and years. Today is a great first step in getting all of us stakeholders together to achieve the great goal of stabilizing these people's lives so that they're not offending at all and have stability in their lives and the dignity of living a healthy and good life. And reduce the resources that we expend over and over again, so we can efficiently expend our resources so we can get more people and be more effective in the people that we're treating.
So for the breakout sessions, this morning we have two. Topic A, which is diverting individuals with behavioral health concerns from jail, and topic B, which involves assisting individuals with behavioral health concerns who have become justice involved. So each session, both topics, will start with speakers that will give you some general information about the current status of the topic. And we want to do this so we're providing you with information about what we're already doing, efforts that we already have undertaken and are currently involved in across the region. So you have an awareness of our current ability to address the topic areas. And then that way you can start to take steps forward. What else can we be doing? And not only just to have these different ideas, but hash those ideas out. Think about what they look like for next steps. We want to have almost like an action plan developed for addressing each of the topic areas when we leave today. If you could think about discussing funding or grant opportunities for the solutions to these problems that you see. Think about how the community can intervene and be involved. Think about how specific agencies might need to be involved and what kind of role they would play or how they can contribute.
I want to thank all of you all for being here. I'm Dr. Matthew Hewitt. I'm the chair of the Behavioral Health Committee. Now I'd like to transition just a little bit and talk about why basic needs and the needs of the individuals who either are on their way to getting incarcerated or are incarcerated are critical. Transportation is a barrier in our community. We've got to do a little bit better with it. The bus service, if it was 4 or 5 years ago, I used to have a bus stop outside my house, and now it's 3 or 4 blocks away. I can only imagine in certain parts of the county. General health needs and medical benefits, physical health. We talked a little bit about mental health today, but people's physical health ties to their mental health, right? I'm sure you all have family members when their health isn't going well, their mental health sort of follows, puts you in a bad mindset. So I mentioned to the Chief Judge, maybe we need to also integrate physical health into this. Transitional care and vocation, people in our community working, the substance abuse professionals, colleagues of mine, that working is the #1 predictor of doing really good in recovery, because for 8-10 hours a day, you're at a job, so you're probably not using. Then if you sleep 8 hours a day, your window of use goes down. If you're homeless, don't have a job, don't have a vocation, your opportunities to use and your mental health lends itself to that kind of use. I think that recovery services are important. It's mentioned. Housing, boy, we know we have a housing issue. We also have a community that we don't want to give things away, right? We want people to earn things. So I think we have to tie all this together. There's disparate systems here today, and I implore you and support you in understanding each system's job. Law enforcement has a job. Judicial officers have a job. Social workers like me, we have a job too, right? We advocate and we fight the good fight for people. But one of the things I want to say is we need to understand each other so that we don't make assumptions about each other. There are certain individuals that we talked about today, probably they should be incarcerated. And then when they do come out, they need transitional services, but they probably shouldn't get out early. There's some individuals that maybe work their way into incarceration that if we had services and housing and vocation and we caught them earlier and maybe family involvement, they wouldn't matriculate on up. So those are things that I want to set the tone for. This is not a judgment sort of summit today. This is a summit of integration, of really serving our community, because the people we talk about are in our community, live in our community, and it's an honorable thing that we're here today. And so I'm just humbled that you all showed up. Like I said, I thought 8 people would come and maybe 2 others we forced, but we have over 100 participants today. I wish we were proactive instead of reactive. And without further ado, I'd like to introduce Joel Siebersma, the Director of Addiction Recovery at Springs Rescue Mission, and one of my colleagues and fighters today. Thank you.
All right. Good morning, everyone. I am from the Springs Rescue Mission. I've been working at the Rescue Mission for a little over 10.5 years now. My official title is, as was said, is Director of Addiction and Recovery. But I also do a lot of community outreach and interfacing. And so you can see a lot of our beliefs and our mission and our vision of why we do things. You know, at the Rescue Mission, we're committed to being a low barrier shelter and to having low barrier services. We do have standards, and there are consequences for really bad behavior, but there is always a pathway back. And we believe that cooperation with law enforcement and fulfillment of court requirements are important parts of personal restoration. And we also believe in assisting individuals to obtain a level of self-sufficiency where further criminal justice involvement becomes less likely. I also wanted to put up a number of the other individuals and other organizations that are doing this as well. This is by no means an exhaustive list. There are lots of others, probably others in this room, that are doing some of this same work, but these are all the community partners that we know of that are working alongside the Rescue Mission, trying to provide basic needs, trying to get people just enough above water so where they can feel like they can deal with the next level of needs that they're experiencing. And we really feel like that is important. And kind of lastly, I wanted to put out there, I asked our shelter coordinator, I said, give me an estimate. How many people in the shelter are criminal justice involved? And he said, well, in their lifetime, probably 75% of our individuals in the shelter have criminal justice involvement, and 25% are currently criminal justice involved. And I know from my own program, the one-year residential drug and alcohol rehab, we're probably around the 75 to 80% of my guys are also criminal justice involved. And we're working hand in hand with parole, with probation, with the court systems to try and bring about the accountability so we can continue restoration and get some individuals living lives of freedom. And so now Dr. Harper will come back up and kind of give us instructions for the next segment. Thank you.
Great. Thank you so much, Joel. And Dr. Hewitt had a lot of really important comments to make to kind of help put into perspective how these different social determinants of health are very closely correlated with determinants of crime. In many ways, outcomes that affect one area affect another. And in order to promote a healthier and safer community, we must make sure that we're developing and maintaining an infrastructure that's supported by a strong foundation of prevention and treatment. To achieve this and to better provide services to individuals with behavioral health concerns and those who are in need, we must consider all of the facets that contribute to being able to provide for these needs. We must fill the gaps that exist in these services in order to connect people with the resources that they need. This again includes considering many major agencies that might be involved, where the funds might come from. So in the interest of helping to further develop what those services look like and how to deliver them, Topic C, our summit session for today, regards how we meet basic needs for individuals with behavioral health concerns. And this, again, is in a preventative interest. So let's take a quick review over topics A and B. Some of the primary elements of topic A that we identified were this need for a regional and community-wide approach to diverting individuals from jail. What this means is that different agencies need to be able to communicate together and advocate for each other and the needs that each other has. So when we develop new resources, we're not keeping those resources in our separate little silos, right? That we're finding a way to help braid resources and funding So if we are doing a crisis intervention training, perhaps for one law enforcement agency, we can invite representatives from CSPD and or El Paso County Sheriff's Department in an integrated effort to deliver a standardized training that will serve the community as a whole. Some of the other suggestions were a need for support and funding for purposeful training. So there will need to be a needs assessment to determine exactly what those kinds of trainings would look like. And I know that there has been a little bit of excitement over a potential increase in the grants for our co-responder programs. So that needs to also continue to develop, right? And that the co-responder programs have the opportunity to identify the needs of the people that they're serving. And more than just identifying those needs, they need to be aware of what other services are available to be able to take these individuals somewhere that isn't the jail, right? And what that process can look like. And so we've discussed, as part of even Topic C's review, that perhaps this living document of developing a resource guide that would maybe be accessible via an app that we could create that could be downloadable and accessible and updated regularly, where these kinds of things wouldn't necessarily need to be something that, you know, you're on your beat, you're on your shift as a law enforcement agent, and you need to know what's that service. Like, you can't say, oh, I have it on my computer, I'll email you, right? Being able to have that access mobilely might be additionally beneficial. So these kinds of conversations have been tossed around a little bit, and I can guarantee you that we'll be taking next steps to see exactly how we might be able to execute something of that nature. So for topic B, we discussed a need for collaboration between the community and the jail in an effort to assist individuals with behavioral health concerns that have become justice involved. So this includes working to help get them out of jail quickly, to develop a treatment plan, and to help prevent their return to jail and what that entire process might look like. One of the things that has been mentioned that I've heard multiple times has been this need to not only inform people that these resources exist, but telling them it exists is not enough. We maybe need to do not just more to actually encourage citizens to utilize resources, but a warm handoff may be very necessary in a lot of situations where someone might need to be transported directly to a service provider, have a treatment plan developed, and through this warm handoff, we're able to increase referrals and the utilization of services for citizens and by citizens. Increasing services inside the jail and during the pretrial phase in order to develop treatment plans and a continuum of care is absolutely integral. This again is something that will help develop capacity for a warm handoff if providers know that they're an integral part or an integral link in this chain of treatment. So we had a really wonderful review of topic C that we just kind of went through around the room, and I'll touch on just a couple of points really briefly. When it came to housing, overarching need for more beds and a development of a spectrum of needs from low to high where we're addressing priority needs. Also, the need for case management to walk through transitional housing, including those that have long-term permanent housing needs. This again helps people become familiar with the different services that are provided so they know how to make recommendations that are best suited for the development of individual service and treatment plans. For food and essential products, we do have a lot of resources. This, again, is the encouragement for developing a resource guide that's a living document that we can edit and maintain regularly. Part of the issue that we've identified is that there may not necessarily be a one-stop shop, right? So if someone needs multiple services and they're having to ride multiple buses and go to multiple places and fill out a variety of different forms, they're going to be very discouraged from doing that. They may not have the capacity to do that at all. So the development of facilities that provide case management for a variety of services, kind of all in one place, is definitely an idea that we can take forward into next steps. When we talk about general health and Medicaid, one of the primary concerns that was addressed includes that Medicaid is often suspended when people are arrested, and how quickly we need to be able to reinstate that upon release. And so again, this is a necessity for having case management in the CJC so we can help get these kinds of services reinstated and working for the individual before they're even walking out the door of the jail. So we discussed also between social support, transitional care, vocational training, and recovery services, I kind of saw a pattern develop in these conversations where we talked about this need to provide information, this need to make sure that people are aware that these services exist, and also that we're following up with people when they do utilize services. So if someone is seeking a service, but we don't have any mechanism for recontacting them, then we have no idea how well the service served them or was able to help them. One of the overarching things that I noticed was this absolute need to develop a follow-up or tracking mechanism for how to determine how well services are working for the people that are utilizing them. And I hope that everyone had the opportunity to learn something new, to meet a new person, to take the opportunity to shake the hand of a criminal justice agency or organization member and or a behavioral health service provider, because this really has been the first time in our county that we have had the opportunity to bring these two different silos together and say, hey, it's time to find a new way forward together. Let me turn the mic over one more time to our Behavioral Health Committee Chair, Dr. Hewitt, for final remarks.
I want to leave you with some thoughts. Can we do something different? Should we do something different? And here's the question I'm going to leave you with. Will we do something different? We need to do some action planning, and I know Commissioner Vanderwerth will support this. And our Behavioral Health Committee will come up with, Alexis and I, some actions. We'll look at some policies. We'll say, here are the gaps and the points we need to attack. But I'm more humbled as a professional that you're here and you heard today, and now you're going to walk out and answer my question. Will we do something different?